It's Move Well, Live Well with PCI Orthopedics. We're joined this morning by Dr. John Hart to talk about something no athlete or really anyone wants to deal with, the dreaded ACL tear. Hi, Dr. Hart.
Hey, Catherine.
Thanks for being here.
Thanks for having me.
Well, let's start with something kind of basic, but can you explain exactly where the ACL sits in the knee?
Yeah, so the ACL is one of two ligaments here in the center of the knee. And it plays a very important role in the stability of the knee, and that is to keep the shin bone or the tibia from sliding too far forward, and it also provides good rotational control as the knee twists.
How do ACL tears happen?
The most common way that ACL tears happen is what we describe as a non-contact twisting injury. So it's common in pivoting sports like soccer or lacrosse.
Pickleball?
Pickleball.
Are you seeing more of those these days?
Definitely so. And football is another common injury. Mm-hmm. The other way these injuries happen is a blow from the side of the knee that will commonly injure the ACL.
So not just athletes.
Not just athletes.
But if you're playing a sport, you should be wary of it. Or is there anything you can do to prevent this?
There are some preventative programs in place, and our physical therapists work closely with high schools in the area to work on stretching and warming up, and also landing mechanics and some strengthening programs in the off season. Mm-hmm. Before a lot of high school programs start, they'll also do some screening for sports that are high risk, to be sure that athletes are primed and can minimize the chance of ACL rupture.
And so if something does happen, do you recommend getting it fixed?
Typically so, and after that kind of injury, the things to look out for commonly, we see a lot of swelling in the knee. So if you had a twisting injury and it was hard to bear weight, or you noticed a lot of swelling in the knee, the swelling's really the key. That would prompt somebody to come in and get checked out. And for athletes, it is important to have the ACL reconstructed, to provide stability to the knee, and that just prevents further injury to the knee as they get back to playing these sports that require a lot of high impact and quick cutting and pivoting. Yes.
Is it always surgery then?
You know, for older folks who maybe have less demands on their knee, not necessarily. For those folks, sometimes therapy is enough to strengthen the muscles around the knee. But for athletes and people, and even older folks who want to get back to some higher demand activities that require cutting and pivoting, the ACL is very important.
Yes. I know a lot of people, older people, like to play pickleball and tennis, like my parents. Yeah, so I think that's important for everybody to know what's the recovery time, and what does recovery look like?
Right after surgery, you are still able to put weight through the knee.
Oh, that's great.
Yeah, and that's important to get up and moving. And in the first portion of the recovery, the first 6 weeks, we're working on getting motion back and working on strengthening the muscles around the knee. At about 3 months, our goal is that you're able to return to jogging, but the full recovery is somewhere between 9 months and a year.
Okay, and somebody with an ACL tear, are they more susceptible to another one down the line?
They are, and some of that has to do with, you know, their anatomy and what caused the ACL to tear in the first place.
Okay.
But a lot of that can be minimized just by proper rehab and recovery.
Your specialty is the knee?
The knee and the shoulder, yeah.
Okay. Yeah, and for the knee, is ACL one of the most common things you see? For
our athletes, it is. Mm-hmm.
All right, so screening, stretching, all of that is what you recommend for athletes?
Yeah, for prevention, getting in with our therapists and working on kind of specific strengthening exercises is something we can do for prevention.
So you don't have to wait till you tear your ACL.
Right, right. A lot of that we can work on preventing in the weight room in the off season leading up to these kind of high risk sports. And
all of that can happen at PCI?
Absolutely.
How can people get in touch with you?
You can call our office at PCI, and we've got an acute clinic and a lot of specialists, everyone to take care of the knee and really all parts of the body to get people back and active.
Thank you, Dr. Hart.
Thank you.